You ready?
Yeah.
Okay, go right ahead.
Good afternoon, everybody. I'm Tony, and for my major is animation and visual effects. Today I will give you a listening and listen. It's talk about end of life and the terminally you are the people who close to death. And at first, I want to ask questions. Do you know how to enlightened animate monks die? The old, very famous song. It's just a monk.
Say again, ask the question one more time now.
How do enlightened animate monks die?
Okay, how do enlightened, eminent monks die? Right?
Yeah.
We've got to practice some rhythm there.
Okay.
So what are well-known monks, monks who are very religious, very sacred, how do they die? Answer his question.
I think they have to stay there and see them.
Yeah, you're right. As far as I know, they will most of them will lock themselves into a small house and for maybe 7 days later without food and water. And as the young monks will open the house and take care of their remains. This kind of dying is peaceful and no suffering. And they have been dying in this way for generations and for thousands of years.
Where are these monks?
What?
Where? What
Maybe,
country?
China or India, maybe.
Thailand? Burma? Right?
Maybe.
Okay, you don't know.
And this is the topic of the listening. When prolonged death seems
Worse than death, okay.
And from Fresh Air on October 9th, 2012. And there are some concepts I need to explain. The hospice.
Hospice, good.
And compassion and choices. This two organizations. Hospice has a mission to help people live as well as they can with the best quality of life. But compassion and choices suppose the right to die, but does not work outside the limits of law. And there's three, price: aiding dying, hesitating dying, or assisted suicide. This is a very important distinctions because the organization Compassion and Choices they doesn't support suicide. They are the patient who they are working with must be terminally ill and decisionally capable. There's three. In this case, there are three main parts: the patients and their families, and the organization Compassion Choices. We talk about the patients first. Of course, they are terminally ill and decisionally capable, and these people have no choice whether they are going to die. They are dying. But they are very informed about health care, and most of them have very good relationship with their health care providers, and most of them have cancer. They are in the treatment is really suffering and painful. They want to know, even though they have this terminally ill, even though they had give up so much and lost so much, they want to they still have some control or some ability to make the choice about their ending. And the families, it's hard to say a very important member have to die, and they all of us don't want to lose them, and no one want to witness, but they have to understand the final decisions. I think they have to understand of the patients. The understand will require a tremendous act of life, and maybe because actually what these patients doing is leaving them, and leaving them maybe sooner than their disease requires. And the last is compassion and choices. It's important to say because when patients came to this organization, they need to figure out a lot of information about the patients, because they need to make sure they are terminally ill, decisionally capable. They will ask them who are they, why are patients calling them, and what's this year like this, and after that they will do something. They will talk about the patients with something. The first thing is about the patient's right to stop at life-prolonging intervention, and the second thing is to talk about stopping eating and drinking, like the monks, like this. The third option is the possibility of patients acquiring or accumulating lethal amount of medication. It means the patients will get some medicine or drugs to cure themselves, and it needs the patients who have a very good self-administer. In my opinion, the people should have the right to choose their way to die when they get close to the end. First, the patients. You cannot say they are want to die when they come to the organization. No one wants to die. As the listening said, they are dying. They are on their way to die. So I think they just need some more choice when they come to the organization who help them to have a peaceful die. And the organization, some other organization says that the physicians assist the dying is fundamentally incompatible with the physician's law as here. But this company, I want to call it CNC. Okay.
Okay, so you're at 8 minutes, Tony. You're at 8 minutes. You're at 8 minutes.
Okay. CNC just provide a choice for the terminally ill, and something need to be mentioned is that the way they help people to die, use the way, not just gives their some drugs. They just ask him to stop eating and drinking, and they believe most people who are living with terminally ill and close to die are not actually very hungry. They just lost their interest about their surrounding or about their loved ones, and they often lose the feel sometimes after they didn't eat anything or drinking. They often lose the feels at sometimes in the first week, and the second week they will have a peaceful death. And in conclusion, I want to say, please let them go if that's their choice, because we have to respect their choice. No one wants to die, and all we need as a family, we need to face the death. they are not they are our family, or we don't want to lose them. Is not the reason that they have to continue to endure the effects of a terminally ill until their dying day. I think following their